right, how you guys doing?
Dr. John Selly is a primary care physician with a private practice.
You can get your temperature.
His day is full, treating patients with all kinds of ailments, whether it's high cholesterol
I'll give you a sheet on some natural ways to lower your cholesterol.
or a foot rash.
Does it hurt at all?
It hurts.
The job has a lot of headaches,
I can send a prescription down for that.
but one of his remedies is business technology.
Try that for a couple weeks. Slows your heart down, so. Anything you want to talk about? Have you been noticing any different?
Dr. Selly went to medical school at Western University of Health Sciences in Southern California. Medicine has always been an important part of his life.
I grew up in a medical family. My mom was a nurse and my father was an orthopedic surgeon. And I became interested in science, so I thought I wanted to be a scientist. But I realized I really liked to work with people. And the combination of science and working with people was, the formula was medicine for me.
During his residency, he realized he wanted to start his practice from the ground up. His hardware startup costs $6,000. And although there have been implementation challenges, IT has been a healthy addition to a small business.
Basically, it improves communication. And healthcare, a lot of healthcare is communication with the patient, with other colleagues, with the front office. Hey, Shaley, can you mail? So it just really makes communication a lot more efficient and easy to do. All right, thanks.
One of the ways Dr. Selly is able to stay more organized is with this tablet. He uses this device everywhere he goes in the office.
This has a wireless antenna and access labs, x-rays, and I can also access the internet and look up any information that might come up as a question during a patient interview. It's very functional. It's my workhorse. I use it every day.
The information that he records on his tablet about a patient goes into an electronic health record. The record is stored on a server that hosts and also manages the software. He pays a $300 monthly subscription fee for the service.
I feel like the electronic health record really makes me more efficient. Creating the note, though, is not that much faster than the old days.
Dr. Selly says he's able to save time because he no longer has to use pen and paper to scribble down his notes. He can also write prescriptions electronically, which cuts down on errors since doctor handwriting can be difficult to decipher.
It's nice because it sends the prescription within milliseconds to the pharmacy. I can do that right now. Let me send that to your pharmacy. 2 tablets at night.
Doctors are known for being difficult to reach with little time on their hands, but Dr. Selly is trying to change that perception by increasing patient communication using technology.
One of the things he did was build a website and email system.
Patients can send me non-urgent messages or questions through the website. What happens is I get an email saying to check the website because I have a message. Generally, the turnaround time is about 72 business hours, I tell patients. Told patient to...
Looking around, it's obvious Dr. Selly's operations are innovative.
Same dose of Coumadin.
But surprisingly, it doesn't take much equipment to run his office.
This is our data center where the data comes through and gets routed to the downtown facility where the information is stored. This is our wireless data point here. This is our router. This is a switch for the Ethernet cables. And this is our voicemail. And this is our wireless phone for the office.
Back against this chart here.
Today, Dr. Selly's small business is in good health.
2 weeks on the 27th.
And he has his pulse on the future.
We have good pulses here. I would like to do more home type remote interactions with patients in their home. You had a question about an allergy to milk? Just being able to capture as much physical data as we can without actually being there.
For BNet, I'm Sumi Das.